Our next speaker is the international guest for the day. Marc Aixala is from Spain, Catalonia. He started out as a telecommunications engineer, but went on to a career as a psychologist and a psychotherapist. He's got a master's degree in integrative psychotherapy and strategic therapy. He also authored a book about psychedelic integration, psychotherapy for non-ordinary states of consciousness. And he serves on the staff of the Growth Transpersonal Training Team. And as a certified holotropic breathwork facilitator, he practices as a psychotherapist in Barcelona, specializing in transformative therapeutic approaches. And today he's going to talk about, more specifically, about psychedelic therapy. How does it work? What are the methods? What are the values? And also, what are the challenges? Please welcome Marc Aixala.
Hello, good afternoon, everybody. So I want to start by thanking the organization that they kindly invited me to be part of this wonderful symposium. I'm very impressed with the level of the talks of this morning, so I'll do my best to be up to the task. So psychedelic therapy, right? This is already old news, but even Prince Harry acknowledges having taken psychedelics to cope with grief and depression and difficulties. So one wonders if psychedelics are already in the British royal family, or are not, no? So how can it get more mainstream than this, right? So yeah, that's what's going on. We hear about psychedelics in many different places, but yeah, it's becoming something normal, something that we hear on a daily basis. For example, Spain is not a very progressive country. Yeah, we have a long story of repression and dictatorship and not very progressive attitudes. But, you read the newspapers and you find things like this. Psychedelics open a new age in the treatment of mental pathology. This is in a right-wing newspaper, so it's not a particularly progressive one. Catalonia advances in the use of psychedelics for treating mental disorders. The main newspaper in the country, A Therapy with MDMA, experts debate the use of psychedelics in medical treatments. And even International New Canada authorizes the use of drugs to treat certain mental illnesses. And of course, Will Smith, Lindsay Lohan, Megan Fox, Sting, and more Hollywood famous people talk about their experiences with ayahuasca. So yeah, this is everywhere. You read on the internet and you read about MDMA, and nowadays it is possible to use MDMA in Canada. I mean, it is legal already. You can go to the psychiatrist and you can get a prescription of MDMA. I've actually seen a picture of a prescription of MDMA. It says MDMA 120 milligrams 111, like 3 administrations. Yeah? Then the question is, how do we do that? How do psychiatrists do that? How do we access these treatments? How are they carried away? Yeah? But it can be done. Same thing in Canada, same thing in Switzerland. Under special circumstances, some psychiatrists can use already these substances. So this is not the future, this is the present, and in countries like Switzerland is the past already. Yeah, so we're not talking about something that's totally new, but it is becoming so mainstream, so widespread that it's everywhere. Again, a newspaper in Spain, Ecstasy, the new treatment for post-traumatic stress. And the subheadline, the entry of this illegal drug in psychiatry could be a revolution for psychiatry. Yeah? Okay. Yeah, everybody's talking about this. Everybody. Last year or a couple of years ago in the MAPS conference, 10,000 people attending a conference. This is quite impressive already, 300 of us here. Imagine 10,000 people gathering there to talk about psychedelics. I mean, this is already field, a business. I don't know what it is, but it's really gone really, really big. Mushrooms are becoming the new trend. Yeah, again, a Catalan TV program talking about how a study carried out in Barcelona speaks about the benefits of psilocybin to treat depression. Yeah, so yeah, we even went to use frog venom or toad venom to treat depression. Yeah, 5-MeO-DMT, a tryptamine that appears naturally in some plants and some animals, is being used to treat depression. So we're back there to the licking toad metaphor, no? That many years ago seemed like the witchcraft was somehow taking over. But this is what's happening. And ketamine has been legal for decades. There's a long story of medical use of ketamine for different circumstances, mostly for pain management and anesthesia. That's something that's used every day in any pediatric unit in any hospital. So ketamine is used every single day. And I have to say that a lot of people don't know about the psychedelic or psychoactive properties of ketamine. So when having conversations with my partner about, she's a pediatric nurse, she says, we do administer ketamine to babies for operations and all that. And sometimes you do see that they behave strangely. No, when they come out of the experience, there's some twitching, something's going on there. Yeah. So then it seems that a better management of ketamine is to induce the with benzodiazepines and other medication that will put you to sleep. You first make the patient sleep and then you administer the ketamine, so they will not go into the psychedelic effects. Yeah? But if you don't consider that, you just inject high doses of ketamine to small babies, yeah, without knowing what that's about. And that happens every day. Yeah. So, yeah, ketamine, another newspaper. Yeah? Ketamine, the revolutionary therapy for depression that expands in Spain without public financing. So, when looking at this landscape, it's easy to be overwhelmed, confused, and really not know what we're talking about when we talk about psychedelic therapy. Yeah? So many things going on at the same time. I remember when I started being interested in this about 2 decades ago, it was relatively easy to be up to the date with the research. You could easily read all the papers on the matter, all of them. There were maybe 15 new papers that would appear, so you could read all of them. Now, we saw this morning a presentation of how exponentially the publications are happening, so it's impossible to keep track of what's going on. Even if you're part of the field, even if you're an active researcher, it's impossible to know what's going on. Things have become unmanageable. Yeah. So then we wonder, what is psychedelic therapy? Because we're always talking about psychedelic therapy here, but what do we mean by psychedelic therapy? Let's try to maybe not answer this question, but think about this question. Yeah. So this will be the intention about today's talks. I want to cover mostly 3 points, and I'm going to go in different directions that I usually go in talks and lectures. I'm going to talk about different aspects of psychedelic-assisted therapy, some core values and principles of this work, and some of the challenges that we might have ahead now that things are getting so big. Yeah. And I always consider an exercise of honesty, and also for you to know where am I coming from, to share a little bit about my previous training. So you can have an idea of when I say things, where have I experienced this, or where does my experience come from. I am not a researcher, so my interest in these substances started long before it was that easy to actually do something about it. If you wanted to become a psychedelic therapist 20 years ago, the possibilities were somehow limited. Yeah. So my entry into this field was through different alternative doors, I would say. I've never worked in a university or in a hospital or an institution that was carrying research until very recently. So my first contact with this was through the underground and through recreational settings. Yeah. So for many years, I trained as a holotropic breathwork practitioner. Holotropic breathwork is a non-drug technique that aims to induce non-ordinary states of consciousness. It was invented by a psychedelic pioneer, Stan Grof, so in a way it draws from the psychedelic principles, but it uses breathwork to induce those states. Yeah? And I have to say that it is very effective, and you can see very dramatic reactions in holotropic breathwork sessions, sometimes even more than in psychedelic sessions. Yeah? So if you go to a group session of holotropic breathwork, that can look like a madhouse. It's like, what the hell are these people doing here? Then you go to a clinical trial and everything is very polite, very sterile, very nice. You could even take pictures if you wanted. No? But in a breathwork, you wouldn't dare to take pictures because that will look like a madhouse. Yeah? So I trained in breathwork, and I also started attending Cosmicer, which is a psychological emergency service in the context of a psytrance festival. I don't know if you know what a psytrance festival is, but you can imagine like a huge rave full of people, yeah, like 40,000 people for a week listening to intense electronic music and using any type of substance in any sort of doses at any given moment and without any sort of supervision or restriction, you know? So you can imagine that plenty of things happen there. Mostly very good things, yeah? But some people run into challenges. It's estimated that about 1% of the participants do need some kind of support during the event. Yeah? 1% of 40,000 is 400 people. That is a significant amount of people to be supported. So Cosmicer is a service that is set up before the festival and ends after the festival. So it's about 10 days of work. And it's a place in which there are groups of volunteers that support people that feel that they need something. Yeah? Sometimes it's people having difficult experiences that they come on their own and share what's going on and you kind of support them. Sometimes it's people that are totally out of control and they are brought to you by security. Yeah? So it can go from a very mild sort of experience that it's inducing anxiety or being somehow challenging to a full-blown episode that could be labeled as a psychotic episode, or even people with previous psychotic disorders that they take psychedelics or they stop taking their medication and they go into an episode during the festival. Yeah, so it can be a really intense experience. I always joke, but no joke, that I learned more about psychopathology in 7 days working there the first time I went than in my 6 months work in a mental hospital when I was finishing my degree in psychology. You know, you see a lot of emergencies. Yeah? Maybe if you work in the acute section of a hospital, you see a lot of these, but as a regular psychologist, it's not that usual to see the intensity of manifestations of people having challenging psychedelic experiences. And then in the latest years, I've been able to work in clinical trials with psilocybin for depression, and that's what I do mostly now. I work training psychedelic therapists for clinical trials. I supervise these therapists. That means watching videos of their sessions that are recorded, both the preparation sessions, the integration sessions, during the administration. So there's some sort of ongoing feedback, so we keep the practices safe and as good as possible. So that is my experience. Again, I'm no researcher. I usually don't use research terminology. I work in research settings, but I'm a clinician. Yeah, so that's what I've drawn my experience from. All right, so let's try to start answering or asking ourselves the question of what is psychedelic therapy. Yeah, should we speak of one psychedelic therapy or should we speak about psychedelic therapies? Are we talking about one thing? Or are we talking about a diverse landscape of understandings of a same phenomenon? Many times when we think about psychedelic therapy, we imagine something like this. Well, I don't know if it's your case, but in my case, I do imagine something like this, which somehow this is an inheritance from the 60s and the 70s. Yeah? This model of doing psychedelic therapy with two therapists, male and female, laying down with the eyes closed, listening to a playlist of music, and in an environment that doesn't look that much like a hospital. This is a room in a hospital, yeah, but it's been tailored to support these types of experiences. This is something that appeared during the 60s. Yeah, the history of how we came to do this, it's quite interesting, but it's not the subject of today. But this is the standard setup, I would say. And it is something that has been used in other research trials. This was with psilocybin, and you can see some spiritual statues here, no? A Buddha, a statue of a mushroom, a flower. So it's not your usual hospital environment. Yeah. In the MDMA trials, they did something similar. You see some more medical equipment here, but this setup looks quite similar. Again, this idea of male and female therapist. Yeah? Back then, it was somehow like the gold standard. We will see now that that gold standard is not gold standard anymore, yeah? For many reasons, but this is not feasible on a large scale. Basically, this is too expensive. Yeah, I had a good conversation with somebody working in a pharmaceutical company. He said, psilocybin therapy needs to be affordable for the states. If we want psilocybin therapy to go before electroconvulsive therapy, for example, it needs to be cheaper than ECT. If it is more expensive, first we're going to try ECT, and then if it doesn't work, we're going to try psilocybin. Yeah, so now that things are going into the mainstream, we start to be bound by the rules of the mainstream, which many times are not therapeutic considerations, but are social, monetary, financial, practical considerations. Yeah. But still, there is something that is still happening. This is a picture of our site in Barcelona. This is not a real session, of course. Two of my colleagues in the room that we use for carrying out these therapies. Now the gold standard has turned into one therapist for one participant. So now we don't have two anymore, it's one person for one person. Yeah. We also conduct clinical trials with 5-MeO-DMT, which is a short-acting, very powerful substance, and the conclusion was that this setup was better. People under 5-MeO-DMT tend to roll, move, scream, shout, and having an elevated bed was not so comfortable, so brought the bed to the floor. Nowadays they have 2 mats on side and side of the bed, yeah? So it's not as tidy as you can see in this picture. So you see how we start to deconstruct a little bit the medical standards of how things should look like and how a treatment, a psychological or medical treatment should be applied. What could be an image of somebody undergoing a session with 5-MeO-DMT, again, not a real session. Okay, so this is one way of understanding psychedelic therapy, but it's not the only one. And this is a ketamine treatment. Yeah, it can be done in many different ways, but it can also be done like this. A much more medical setting. This doesn't look as cozy as the previous rooms that we've seen. It is more like, okay, a practical place to have the person safely laying down, injecting the ketamine with music, eyes closed. Yeah. So we see here a more medical kind of approach. I'm going to administer you a medication, and you're going to go through the effects, and we hope that that's going to help you. Yeah. If you compare this to the first image that we saw with the Buddha and the mushroom, we can see how probably in the mind of the person administering this therapy are different things going on. Yeah. Why would somebody have a Buddha in a room for administering psilocybin, and why would somebody have the room like this? No. Things can become even more interesting. Now you have takeaway ketamine. Yeah? I think that not in Europe yet, but in the United States, you can buy ketamine treatments. They ship it to you. You administer it yourself according to the manual. And if you want, you can have some preparation or some integration sessions online with somebody. But if you don't want to, you can just take the ketamine. Yeah? So this is starting to be something different. Yeah? All the way from what they do at Johns Hopkins and to this. But things can be even more complicated. Take it some thousands of miles south, and this is another landscape that we find. Yeah? A Maloca, a sort of cabin in the Amazon forest in which people gather and drink ayahuasca and have their deep experiences. Yeah? Sometimes with more traditional approach, if we want, like some healers from native and indigenous peoples that have been using this for, I don't know, centuries or more, but also with a lot of Westerners going there. Yeah? So shamanic practices are somehow evolving as well to bring us in and to make room for our beliefs and our needs. It's interesting to hear. I have a colleague that's a journalist that lives down there and made a documentary. He talks about how shamans, they openly say how they've modified their practices. Say, no, now gringos, they really want to have a lot of visions when they drink ayahuasca. So we put more chacruna, we put more leaves. That's a DMT-containing plant. We didn't use so many leaves because we don't need so many visions. We put more emphasis on the purging. But you know, the gringos, they want the visions. So, no, and it's true. I mean, it's a communication of what is the person looking for, what am I offering. So, yeah, there's different needs, different preferences, and therefore different practices. Yeah. And then we can take this to a whole new level, or the neo-shamanic approaches, no? With these wonderful places built in any city in the world or in any countryside place in the world, in which it starts to become more blurry what we're doing here. Is this a shamanic practice? Is this a psychotherapeutic practice? Is this psychedelic therapy? Is this indigenous shamanism? Is this new age stuff? You know, so it starts to become more complex to know what we are doing. And all of these people are taking similar substances, yeah, DMT, ayahuasca, psilocybin, but it looks completely different. So how similar or how different is what we are doing when we administer psilocybin in a hospital to a depressed participant compared to what Gordon Wasson did the first time that a white man reported taking mushrooms with Maria Sabina? Is it the same thing? Is it a different field or even discipline? You know, it's not an easy question to answer, but all this is a reality. All these things happen. Yeah. So I asked AI to depict what is psychedelic therapy. Yeah, and he or she, I think of her as a she, came up with this, which, all right, on the surface is okay, but it's also a little bit confusing. You know, what's going on here? You know, this guy with the jeans kind of torn, the doctor. I don't know what the doctor's doing, but no, there's some shamanic stuff, there's some medical stuff. So it seems that AI is as confused as we are. Yeah? So that is good. That is good. Yeah. So when we talk about psychedelic therapy, mostly we think about this structure. Yeah. And it's been said this morning how important it is to think about psychedelic therapy having at least these three parts: preparation, the session, and integration. So preparation refers to everything that we do before, whatever it is. The session is what we do during the administration, and integration would be what we do immediately after. Again, these are very vague terms. You've seen in the pictures before, the kind of session can be radically different in one setting from another setting. Therefore, the preparation and the integration will also be very different in one setting and the other setting. That's still psychedelic therapy, or what is that? I don't know. What I know is that we place a lot of importance in this structure, yeah? And mostly what's happening nowadays is that we focus a lot on the experience itself. So all these headlines that we read in the newspapers is basically you take MDMA and you're cured of your PTSD. I mean, what we can hear, it's like this is this revolutionary pill that can solve this, yeah? Or you take psilocybin and your depression is cured. I think that's a good headline, but I think that it is not very nuanced. It's not very similar to the reality. And this morning we've heard some of this when talking about process, yeah? And so for me, and there is something that I came up last night, yeah, it's a little bit more like this, yeah? I think we should not understand psychedelic therapy as an event. I go there and I take something. We need to understand it more as a process, yeah? And Marc before was talking about the importance of the relationship with, I don't know how you said it, but the relationship with my parts. It's not so much about healing this 3-year-old, it's more of, or making it disappear. It's more like, how do I relate with this 3-year-old part, yeah? So I think that psychedelic therapy is a lot about that. It's about of how we engage with our own inner process. You can call it parts, you can call it however you want to call it, but how do I engage and relate with my own inner process? Therefore, for me, it is essential to understand psychedelic therapy as a process. If we understand it as an event, I think that we are, first of all, that's not true, and second, it's not going to help to create practices. We saw also in the first talk this morning how Leticia was showing us the testimony of a woman that participated in a clinical trial, and she felt that she suffered there. No? The experience was tough, but 1 year later, she had a different view. Okay, I would go again through all this. Yeah, that speaks of a process. If we would only look at those 3 weeks or a month of the treatment, we could say that this treatment has failed, this treatment is dangerous, and that is an important view, yeah, to look at what happens there, but also that the story doesn't finish there. That person goes back to their life, they continue living, and things happen after this experience. So if we lose track that most of the time psychedelic experiences are the beginning of something, they are the catalyzer of something, it's not the end of a process, then I think that we're not understanding what we're doing here. And it is something that it was said already in the 60s and the 70s when psychedelics were used for a more sort of spiritual and rebellious intention. A lot of the Buddhist teachers, Western Buddhist teachers, and this morning Jack Kornfield was mentioned, Jack Kornfield talks about how psychedelic experiences were very important in the early stages of his spiritual awakening, and how that was a catalyst to go into a different life, become a Buddhist monk and whatever. Yeah. So psychedelics as catalyzers, as seeds, are something that initiates a process, but not the end of my depression or the end of my suffering. Of course, it can be an important milestone, but it is not you have a headache, you take an aspirin and it goes away. This is not how they work. Yeah. So the thing is that the psychedelic landscape is going to be very diverse. We will not have one type of approach. We will have different people doing different stuff. We'll have different people looking for different practices. For some people, it will never make sense to go into a hospital and take a synthesized version of a mushroom. For some people, that will not make any sense. It's like, no, I'm going to go to a ceremony. That's where I feel more comfortable. Yeah? Some people would never go to a ceremony. What do you mean? Going with a bunch of people singing to Pachamama songs or whatever. Give me a doctor with a white robe and somebody that has a PhD, and that I can trust. Yeah, that is going to happen. So aiming to standardize things and saying what's right and what's wrong, I don't think that will work, because it would be like trying to enforce a certain way of doing things. And I guess that you can agree with me that psychedelics are not that type of substance that can be somehow enforced, like you should be doing it like this. You can try, but the genie is out of the bottle, as they say, no? They will find ways to the underground, to recreational settings, to shamanic settings. That is going to happen. So what we do with that? So then when trying to understand psychedelic therapy, is there any basics that we can go back to? So that's why I decided today to talk about values. Instead of focusing very much on how to do this, what do we say in preparation, what do we do in integration, I focused on this in the previous 10 years, and now I'm focusing on something else. So what I believe that these different practices that we've seen can have in common are certain values. Yeah? And I don't think we talk a lot about values in the psychedelic scene. Why are we interested in this? Why are we doing this? Why are we fighting for these therapies to be available? What is our motivation? Is my motivation the same motivation as, I don't know, pharmaceutical companies or investors or patients? I don't know. Yeah, but different actors, different intentions. So why talk about values? Well, I have a friend that he's a Buddhist teacher, and told me that if we take away values from certain practices, they can become dangerous. Yeah, mindfulness, which is something based on the Buddhist tradition, can be used to train a better hitman. No? Somebody will be fully focused and will be able to execute selective assassinations without blinking. I can imagine a program that would include mindfulness to create a better killer. No? Is that what we want? Some people do want that, but is that what we want? So what's happening with psychedelics? I think that we need to have this reflection of what are the values underlying what we're doing here. Yeah. One of the main values that in most approaches we agree is a non-directive approach. When we do psychedelic therapy, it's understood that we provide certain conditions and people have their own experiences, and there's no need for the therapist to tell them you should explore this or that, or you have father issues, so let's talk about your father during the psychedelic experience. It doesn't work like that. It seems that with psychedelics we rely more on what it's sometimes been called the inner healing capacities, inner healing mechanisms, inner wisdom. Yeah. So there seems to be a certain trust in the psychedelic paradigm that if we provide conditions and then we apply these substances, people can have meaningful experiences that will be healing for them without us having to do anything in particular. Yeah. Then this could be a debate for any other time, no? But is it really possible to be non-directive? The first axiom of human communication says that it is impossible not to communicate, even if you don't speak. You will have an influence because you're there. Yeah. So how directive or non-directive can we really be? That's why I like sometimes to shift the language and say instead of non-directive, inner directive. That the interventions that we therapists do with participants have the aim of bringing the awareness and the consciousness towards their inner process. Yeah, so it's like stay in touch with your experience, stay in touch with what's going on. You don't have to tell me, I don't have to know about it, but it's important that you are aware of what's going in your experience. Yeah, it's like knowing, almost like you would have an observer. You are having an experience and you're aware that you're having that experience. That's what we're aiming, that's where we're placing our direction. Yeah, that's where we're going, to the inner experience, the inner journey. Another principle is a collaborative attitude compared to the expert and patient sort of approach. Yeah? Traditional therapy, traditional medicine assumes that the doctor knows best, therefore they are the experts on what's going on. Psychedelic therapy many times reverses that idea. It's like, well, we are not experts on our patients, they are their own experts. Here in the image you have a depiction by Brian Bloomberg of Albert Hoffman's first psychedelic experience. We heard about it this morning as well. What the story doesn't talk that much about is this woman here, Susie Ramstein, who was Albert Hoffman's assistant, and maybe she could be considered the first psychedelic seeker in Western history. Yeah. Susie Ramstein walked Albert Hoffman along with the bicycle all the way back home when he was under 250 micrograms of LSD. That could have been an interesting task, no? And sometimes I wonder what would have happened with good old Albert if Susie Ramstein was not there. He was alone in his laboratory, he goes all crazy with 250 milligrams of LSD, and there's nobody there to take care of him. Maybe we're not here. No, maybe they say he had a psychotic break or whatever, no, and the story would be different. This is just speculation, yeah, but probably the story would be different if there was not a seater there. And I think that she's a good example because history has not treated Susie Ramstein with a lot of recognition. Yeah, we barely know about her, but surely she had a role. But this also illustrates the focus of psychedelic therapy. It should not be about us, the therapist. It should be about the person having the experience. Yeah, so it's not how great we are and how good interventions we make, but it's how well we can support the bicycle journey without interfering with this. And at the end of the journey, it's not like, wow, Susie Ramstein, thank you very much. If it was not for you, I would have not done this. But it's more like, wow, I did it. Yeah. So this is something that we're looking for. It's not because of the therapist. It's not because of the substance. It's because of me, the participant, the patient, that I've been able to overcome my suffering, my traumas, whatever. Yeah. So that's something that we're looking for. Another principle, I would say, is what in the holotropic tradition we call doing, not doing. Yeah, most of the times, if things go well, if you've done a good screening, good preparation, the dose is correct, people are ready to go, psychedelic sitting looks not exactly like this, but you get the point. Yeah, most of the times there's not a lot to be done. Yeah, and it is important to know that we can do a lot by not doing a lot. Sometimes the best intervention is not to intervene, to give space to the person, to give time for them to be with their own emotions or whatever. Yeah, but we need to know that things can get out of hand sometimes. Yeah, and if we are not trained or we are not prepared to handle difficult situations, that can become a very problematic moment. Yeah, so it's a combination of knowing what to do and not doing what is not needed. Yeah. Another principle is curiosity. A teacher of mine used to say that curiosity is maybe the most important emotion in psychotherapy, because if you are feeling fear, but you add a few drops of curiosity, then that fear radically changes. Yeah? Curiosity has the capacity to make any emotion transform and to allow us the courage to continue looking into what's going on. Yeah? So curiosity should be fostered both by the therapist and the participant. That should be like an inner attitude that we have when going into this stage, rather than having the attitude of, I know what this person needs, I know how they need to process their trauma, I know how they need to overcome their depression. You know, like this attitude of not knowing, but being curious about. Another very important cornerstone is safety and ethical behaviors and healthy boundaries. Yeah? People in psychedelic states and afterwards, they go into very vulnerable and sensitive states of being, and it's easy, so because they are more open, it's easy that we can have a deep impact on these people, both for the positive and for the negative. Yeah? So therefore it becomes really important to define ethical practices and to be able to keep healthy boundaries, even when people, participants, don't know how to keep their boundaries. It can happen sometimes in a session that people feel that what they need is to, and this is something that I have experienced myself, they need to relieve a trauma. I say, no, but the way that it happened is that my father was trying to rape me and he was on top of me and was choking me, so I need you to do the same thing for me to be able to feel that. So the person is asking that, so it must be right, okay? No. We need to be the safekeepers of the person when they cannot keep their own boundaries. Yeah? And we've seen how this can be something that's gone south in some clinical trials, but also in underground settings and recreational settings and shamanic settings. We have news of shamans abusing their participants, of therapists participating in MDMA trials that they went on and had sexual relationships with their clients. And so these things happen. Yeah, and it's important to pay attention to this, because sometimes we bring on some old school modalities in which there's the idea that touch can be very healthy or very useful in psychedelic states, and I don't disagree in principle. Yeah, touch, physical contact can be very nurturing, but it's a double-edged sword. Yeah, it's a very sensitive issue. When are we doing it for the sake of the participant, and when are we doing it for our own ego needs as therapists, and to show ourselves that I'm a really good healer and I'm going to give this person the love that they have never received? You know, things can go twisted very, very easily. So that's why it's very important to keep certain boundaries and have clarity about them. I think that the path of a psychedelic therapist sometimes is a little bit like this. Especially if you're working in unregulated settings. Yeah, I don't mean only the underground, but I also mean if you're running retreats without the protection of an institution, or like if you're running a clinical trial, everything is on camera, everything is recorded, so it's easier to kind of have to adhere to certain boundaries. Yeah, but when things are more loose, and in these underground trainings and kind of semi-legal retreats, it's easier that boundaries start diluting a little bit and we get into confusing situations. Last week, I received a message from somebody saying, hey, I need advice on a matter. How long do you think it should be before somebody in a retreat engages in a romantic relationship with a participant. I mean, of course, you go to a retreat, there's a lot of beautiful people, everybody's very open, we share from the heart, you meet your soulmate or whatever, and people fall in love, the shaman with the whatever. How should we address the situation? This was a WhatsApp message, well, I don't know if I can solve the situation in a WhatsApp message. Maybe I can give you my 2 cents, but this is a deeper conversation, yeah? Also, I think it's important to cultivate the value or the attitude of trust. Trust from the participant to the therapist, from the therapist to the participant, that participants can trust their own inner process. Like, no matter what happens here, I can trust that it is for my own good. Yeah? So fostering this idea of trust. And I think that we can do that also as therapists by having a positive regard on our clients, by being able to see beyond their neuroses, to see beyond their traumas, to see beyond their suffering, to see the parts that work well, to see the part of them that are actually loving and beautiful and don't need any healing, that there's something already good in that person. And most of all, I think that it's also very important to cultivate humility. It's very easy to become self-inflated when providing these types of experiences. If you're a therapist, you're already receiving some high praises from your clients most of the time, so it's easy to become a little bit inflated. But if on top of that you're giving drugs to people, it's much easier to start thinking that you're some sort of healer, shaman, god, guru. Yeah? And we've seen how these things happen. Yeah? So humility, I think that it's always something to keep in mind or in heart. So some challenges or some reflections for the upcoming times. I think that the first thing is that psychedelics will ask us to redefine some therapeutic practices, some principles of our therapeutic and medical work. So that means that a lot of us, we need to unlearn certain things that we've done. In my work of training therapists, maybe the main challenge is that people need to let go of certain things that they are very aware of. It's like, no, but this is my training, this works, these techniques that I use. Yeah, but to practice in this way, you need to unlearn. You need to stop doing certain things. Yeah. Well, some of these are self-explanatory. But also we therapists, and especially if you're new to the field, we need to become more used to the psychedelic experience. Because psychedelic experiences can go very peacefully, but they can go very wrong sometimes. Yeah? So we as therapists need to develop certain capacity to be in front of these extreme manifestations. Yeah? It's very easy to be triggered when you see a participant that's taking a dose of psilocybin and all of a sudden they go into a really intense and frightening experience. It's normal that we become activated, and then we can lose our presence, we can lose our concentration, and okay, haloperidol, please. Well, not haloperidol, but a new generation antipsychotic. Usually that is not needed, yeah, but we can become panicked if we don't have enough sort of experience in this type of in the situations. Yeah. Also remembering this idea that psychedelic therapy will threaten the traditional boundaries. There's going to be more projections, there's going to be more intimacy than with your regular therapist. Within a month of working in a clinical trial, you can feel like you've been working with this person for 2 years. So that's going to bring some challenges. Yeah. What about psychedelic therapists? Should psychedelic therapists have psychedelic experiences? I'm not going to get into this question, but we could. Yes, why, how many, how often, which kind? Can we support people even if we have not had these sort of experiences? So that's something that we will need to think about, of how we train future psychedelic therapists. What kind of experiential training we will share, yeah? How do we know that people have embodied these values that we were talking about? How do we assess if values have really been conveyed? Yeah? And then I think it's always important to remember that what we're doing in this work is not something that we're just making up now, yet something that is inherited from traditional practices. So we're using many similar substances that what indigenous peoples have used for hundreds of years. And in a way, psychedelic therapy, I find it very similar to, or being a sitter or a psychedelic therapist is similar to being a midwife. Those of you that have seen the delivery process, you see how the process is not about the midwife. She's not the main character there, but it can make a big difference. Yeah? The important is the mother and the baby being born, but the midwife has a great role. Most of the times that role is being silent and not interfering too much with the process, but intervening when needs to intervene, and how she does it, or he does it, mostly she, that makes a difference in the overall experience. And those of you that had kids, you know that it can be a really amazing and beautiful experience, but there's also reports of how childbirth has become hellish for a lot of people. Yeah? Why is that? Is because childbirth itself? No, it's because the extra pharmacological components, yeah, where it's happening, who is there, the attitudes that they have. So I think that this is what we need to focus on if we're aiming to bring this to the mainstream. So, yeah, in these times that we can be blinded by these headlines that we see in the media, and with all this research happening, and with all these companies pushing to create new treatments and new substances, we wonder, how can we convey these values? How can we make sure that this next generation of therapists, and when this becomes available for a higher population, we will be practicing with integrity, with ethical behavior? How do we know that therapists are doing in that very moment, in the session itself, not in the data that we will see and in the meta-analysis, in that session, in that moment? How do we ensure that participants are going to be treated fairly? Yeah? And I think that these are essential questions that we need to continue asking ourselves if we want that psychedelic therapy is to use for our patients, but also for humanity as a whole. So this is it. Thank you so much. I think I took all my time, so...
We can allow one or two questions, so
okay,
feel free to pick.
Gentleman over there. Thank you.
Hi, Marc. Thank you for your very insightful presentation. I'm very happy to meet an author of the few books I've read in my life. Very humbling experience. The book that you wrote was about integration of psychedelic experience and psychedelic therapy. And I was wondering how so many, thank you. No more shouting then, I guess. So many years later now, after you wrote the book and you're much more experienced now, what would you tell the audience is maybe the most valuable tool in integrating a psychedelic experience?
I will steal a phrase from William Richards, one of the pioneers of psychedelic therapy. An hour of preparation is worth 10 hours of integration. Yeah. So I've happened to work in integration, not because of personal interest, but life put me there. And then I specialized in that and I did my best. But I think that it's much more important to consider what we're doing before and during the experience than what needs to be done after. I think that this is a result of our society. We want things like, all right, I'm going to go to Peru to drink ayahuasca and heal this suffering that I have. You go, you do that because you have the money to do it, and then you come back home and things have not changed. And then it's like, okay, what now? And then we create integration. And I can sell it to you. You can come to my sessions and I will do a proper integration. Yeah? But I think that the question is better, what could I do before I have this experience to make sure that it is really useful? That this is an experience that is properly supported and that it's done in a moment and in a time and in a way that will be useful. You know, for me, that is the next sort of frontier, and that's what I'm focusing in these late years. No, I'm not focusing that much on integration. I'm focusing more on how to do this right, so we don't need integration. You know, yeah. Thank you so much.
Or you can just stay on the stage because you're part of the next panel with the clinicians.
Sure.